Good afternoon. All. I'm Mrs. Deepikashree from the Department of Physician Assistant, SNS. Now we are going to see the lecturer video on encephalitis. We are going to first we explain the case scenario and then move on to the conditions. That is, the 42-year-old male presented with the complaints of severe headache associated with fever and vomiting for the past 2 days. How will you manage this patient? So the patient having the vomiting, severe headache, so it may be a neurological thing. So that way, that angle we can um, move the patient. Now we are going to first thing is definition. The definition: encephalitis is a rare yet serious disease that can be life-threatening. Encephalitis is the inflammation of the brain tissue. In this picture, we can able to see the virus accumulated in a brain. The most common causes viral infections. The encephalitis is the inflammation of the brain. So the causes of encephalitis is the common virus, including HSV, that means herpes simplex virus, and EBV, Epstein-Barr virus, childhood virus, including measles and mumps. The arbovirus spread by mosquito, ticks, and other insects, including Japanese encephalitis, West Nile encephalitis, and tick-borne encephalitis. The secondary encephalitis is caused by the complication of a viral infection. So the type of encephalitis is the primary encephalitis and secondary encephalitis. Now, the primary encephalitis, it occurs when a virus directly infects the brain and spinal cord. Secondary encephalitis, it occurs when a infection start elsewhere or in a body and then travel to your brain. So that is the primary and secondary causes of the encephalitis. The causative organism enter through the brain directly, and it passes through the brain infections. That is primary encephalitis causes virus. The second thing is infection start outside the brain, which spread to the brain and which leads to brain infection. That is secondary one. The causes of secondary encephalitis is vaccine, infection, tumor, post infection, encephalitis, autoimmune condition. These are all the common causes. And now we are moving to the pathophysiology. So the pathophysiology is diffuse cerebral edema or congestion and hemorrhages, which can lead to necrosis and degeneration of the neurons, which leads to meningeal congestion with mononuclear infiltration, perivascular tissue necrosis, and myelin breakdown, which leads to proliferation, the type of infected agents, and which leads to a demyelination, vascular and perivascular destruction, and cerebral cortical involvement, which leads to, in case of rabies and herpes simplex virus, the specific inclusion are identified. Characterized pathological changes are found in falciparum malaria. And another one is risk factors. The major risk factors are only in older adults and children under the age of 1 year, people with weak immune systems. The common risk conditions are hepatic encephalopathy, portal vein thrombosis, infection, acute kidney injury, electrolyte derangements, gastrointestinal bleed, hypoxemia, and hypercapnia. So these are all the common risk factors. Another one is symptoms: fever, headache, vomiting, neck stiffness, lethargy, exotic, exhaustion, confusion, drowsiness, hallucination, slower movements, coma, seizure, irritable, sensitive to light, and unconscious. So these are all the 10 things which causes the during encephalitis. And medical history collection, physical examination, CSF study helps to differentiate the condition from meningitis. Blood examination for glucose, urea, electrolyte, and metabolic products. Urine examination, toxicologic studies, and virology study, CT and MRI. Another one is treatment goal, to enhance the cerebral tissue perfusion, for that to maintain fluid balance, to reduce the fever, to reduce the pain, to return to optimal level of functioning or motility. So the medical management, pharmacological management, that is anti-inflammatory drug and antipyretic, that is acetaminophen, ibuprofen, naproxen sodium, are to relieve headache and fever. Another one is antiviral drug, and mannitol or glycerol may be used to reduce the intracranial pressure. Corticosteroids, antibiotics, vitamin and mineral supplements, IV fluid therapy, and dopamine to be given to treat shock and fluid electrolyte imbalance, and anticonvulsion drugs. And the non-pharmacological managements are oxygenation to be provided by nasal cannula. Mechanical ventilation is necessary to cardio respiratory insufficiency. So these are all the thing we explain about the encephalitis. Thank you.